اتكلم من القلب لان هو عاشت التجربه انها بدات حبه الجينيكولوجي اشتغلته، واحنا هتعرض لنا الكلام على ايتم واحد بس. هي حاطه لايبوليسيس لكن انت مخبيه دي فوق دي. الدكتوره نجوى حسن هي كونسلتنت، ويعني جميل ان احنا نسمع لها، بس من فضلك ان فيري شورت لان احنا عندنا سكيدول مليان قوي.
Hi everyone, I'm Dr. نجوى حسن خليل, consultant obstetric and gynecology, and as I may say, I'm now aesthetic gynecologist, and I hope all of you be aesthetic gynecologists one day, please. Before I start, I really would like to thank Dr. Asim about the very successful and efficient and beneficial second international aesthetic gynecology conference, and really thank him to give me the chance, invite me to give me the honor to speak in this really good conference. If you really consider or thinking about practicing aesthetic gynecology in your clinic, you have to listen carefully to what I'm gonna say right now, because maybe this is gonna be the first device you can start, because it's cheap, simple, and safe. And now we will see. We will talk now about cavitation lipolysis, and after that, how to market to the new service in your clinic, okay? What is cavitation lipolysis and how it works? It's for reduction of fat deposit in certain area in the body. It decreases the area from 2 to 5 centimeter thickness every session. For maximum effect, from 10 to 12 sessions every week. You can make 2 sessions every week, okay? And it's a weight size reduction, not weight loss, okay? We have nothing to do with weight loss, only reshaping of the body. Through a gentle heat and low frequency ultrasound waves that make fat cells liquefy and reduce their content. Ultrasonic waves create a compression cycle, exert positive and expansion cycle. This pushing and pulling really cracking the cell and make cavities in the cell, and the heat liquefies the fat to be absorbed in lymphatic system. And ultrasonic energy in the deeper layer can prevent cavities, that's the name cavitation come in the fat, theoretically decrease the overall thickness of the adipose layer. The mechanical acoustic effect of ultrasound cavitation causes selective fat cell disruption without any injury to skin, vessels, any connective tissue or nerve. So that's come safety, only work on fat. After disturbance of the fat cell, the substance, principally triglycerides, are scattered in the interstitial tissue. Afterward, transported through the vascular lymphatic framework to liver to be metabolized. You know, here is some sort of secret. If the patient didn't drink a lot of water to prompt the metabolism or make activity like walking 3 or 2-3 hours a day, this triglyceride, fatty acid, and glycerol that liquefy may go into the circulation and reaccumulate again in the body. That's why some patients use cavitation, said it's magical, it's really magical. And another patient really used cavitation, it didn't do something for me. This is the trick. A lot of water, walking, and low carb diet, okay? These triglycerides are hypothetically retained gradually, and after that are metabolized for endogenous lipase to glycerol and unsaturated fat. Precautions, that's what I'm talking about. Good hydration, 3 liter or 4 liter. Water mean life for person. What about the metabolism? Walking for 2 hours daily, go on low carb diet and low fat diet, stop smoking, drinking alcohol, non-steroidal anti-inflammatory. The walking, we really explained that. Low carb diet and low fat diet, it's not, it's complementary, it's extra advantage. You know, as I'm telling Dr. Asim yesterday, in Arabic, حفرة أنا عايز أشيلها. ماسك جاروف وعمالة أحدف وارمي الناحيه الثانيه. المريضه لو عماله تحط لي الناحيه الثانيه وتاكل وتحط لي دهون وكربوهيدرات هتقل، بس مش هتقل perfectly. We need a perfection in our work because it is starting procedures. Okay? Effectiveness of cavitation. It's effective against all body fat, even the visceral fat. The perfect area to work by cavitation device: abdomen, side, buttock, even upper arm. The perfect place is a bag because you compress against bone. It's little area. Abdomen is lax. You compress it against cavity. Okay. The perfect session take from 20 minutes to 50 minutes, and you only work a one body area per session. Don't be greedy. I will do this and this part and this part. Now you're really harming the liver and you exhausting your patient mentally, financially, and exhaust her body and liver. Side effect of cavitation, it's really nothing. All short term and self-limiting. Some bruises, but the bruises itself not because the cavitation head, but the vacuum head. I will explain later, okay? Headache because the acoustic wave, the patient really listen in her head for 20 minutes or even 50 minutes. It's much, but the headache gets used or disappear or get used on it. After third session, maybe she say it's okay. Redness in the skin, some pimple in skin really resolve in 2-3 hours or maybe second day, and you have to inform the patient about the side effect for not making her terrified. Contraindication, this is must, okay? You must talk to the patient. Really, you don't want to start with a big failure. Is a contraindication, all cardiac patient, because a lot of hyperlipidemias will happen, a lot of cholesterol, free fatty acid in the circulation and go to lymphatic. All cardiac patient, diabetic, pregnant, liver disease, hyper or hypothyroidism for the metabolism, of course, hyperlipidemias, patient with any metal implants in their body, like pacemaker, IUDs, or wires in their body. This is the cavitation device, of course. This is the heads of the cavitation. Pointer. You know, okay. This is the cavitation head you use first. In the session, you do a lot of techniques for protecting. You not only reduce the size or decrease the size of abdomen, for example, but after that, she will be redundant skin. You don't leave her. So you do cavitation for 20 minutes, then you do a suction head for 10 minutes. Suction, why? You liquefy the fat. It's become simple and liquefied. There is a cellulite. You need to remove by suction from place to place to really stretch the fibrous tissue. So you are now shaping the body. And redundant skin, you do a radio frequency head for 10 minutes. Now you have a perfect, really restful patient, and she will love you very much. And this head tripods is for face, but only you can use it. Don't use face on the patient. We are gynecologists and aesthetic gynecology. Don't interfere to other branch dermatologists. Leave it to dermatologists, okay? Don't work in the face. And this is the waves, acoustic wave that disrupt the fat cells. Now I can say cavitation is the most safe, cheap, non-painful, non-surgical, and effective device for lipolysis if it's really done perfectly, like I said, okay? You have a lot of patients in your clinic really work cavitation, not only aesthetic. For my clinical experience, a PCO patient, polycystic ovarian patient, don't you tell her to lose weight, lose fat, okay? I have 5 patients in my clinic which were infertile. First one was 31 years old and she's infertile. After we did 12 sessions, she get pregnant alone. Her intention was to decrease her abdomen, not to deliver or get pregnant. I have 2 patients become PCO and infertile, really get pregnant with a triplet. And that's my facts. It's not scientific, but it's my clinical experience in my clinic.
It's true يا دكتورة نجوى. In one of the researches, the most important line of the treatment ان احنا نبدا الاول نريديوس الفات، يعني ما تكونش واحده عندي 120 كيلو ونبدا نعمل كلوميد ونوفليت او نعمل اوفيليشن اندكشن. الاديبوز لا زال في الاندروجين موجود، وبالتالي if you are getting rid of this source of androgen you are improving. ف 30% of the lady, if there is change in the weight by itself, they will ovulate spontaneously. ده بيأكد كلامك ان فعلا
5 patients really it's big number in only 1.5
دكتورة نجوى ما نتكلمش في الفلوس، لكن هي بتقول لو انتوا جبت الجهاز ما تروحش تقول لها بقى خسي، استعملي جلسات وهي هتمبروف بعدها بقى الكلوميفين والحاجات التانية.
Now the other part, how to advertise to the new technique in your clinic. You know, I buy a lot of devices now. I know a new technique, but the patient only gets used that you are only obstetrician for delivery, for menorrhagia, for infection only. But that's a new era right now. How to advertise for these new techniques. Aesthetic gynecology is a must. And in the new era, after I hear the lecture of Dr. Asim, really I have to change this sentence. It's a must and complementary to make the makeover, right? Why it's must? Why it's must? You know, searching word in searching engine like Google or even social media, Facebook, Instagram, Yahoo, YouTube, all about beauty. Hypho, filler, laser, botic, OO shot, G-spot, rejuvenation of the vagina, tightening of the vagina, hyaluronic acid. This is the most popular searching word. That means what? That means a new era. That means that the most really asked by the patient, the people, male or female. It's not including only female. It's very easier to really work aesthetic gynecology in your clinic. Why? Because already you have the clinic. You will not pay nothing. And also you have the patient waiting, and all of them female seeking for beauty and reshaping and rejuvenation, waiting in your waiting room outside your office. And already you have the finance now to buy the devices and the material. And the most important, you have really the experience to talk and convince your patient by the new technique. Now you buy the material also. Okay, is it enough? No. How do your patient gonna know? This is what we will know. Marketing is the magical tool in every way, not only in aesthetic gynecology, in your clinic. About obstetric gynecology service, marketing is the magical tool. The simplest way of marketing to put a big brochure in clear area in your clinic. Saying about, I have hypho, radio frequency for tightening of the skin, or tightening of vagina, OO shot for increasing sensation, and leave the patient ask you inside your office, okay? Now you can make the TV in your video in your waiting room, or don't let it only songs, music, but also you can record a simple video on your laptop about the new technique, USB device, put it in the waiting room in the TV. Patient new or seeing a video, what about the new techniques that you really do? Facebook pages, Instagram, you can make it, okay? If you don't do that, give yourself to a marketer who can market perfectly and easily to you. And all these marketing tools is free. You pay nothing. You make a page, Facebook, write your name, put a post about everything. You know, I buy a Dermapen device 1 week ago. How I marketed to this Dermapen? They know I have aesthetic gynecology. They get used on my devices, the new device. How I market? I put a post on my Facebook page telling, really, I have a perfect present for my patients that deliver 3 times with me, or 2 times. Now I re-edit the post after you say, I am here in the post, okay? And I really edit the post and I write, and 1 dermabend session for rejuvenation of the vulva, free, completely free and present from me to my patients that deliver 3 times from me. Offer 50% to the patient who delivered twice with me. 25% to patient who delivered once with me. Okay, that's now my patient knew about the technique. Whole world knew about my technique. I can make posts or even a marketing to my clinic through a paying by visa, okay? Now to come to the very loved part in my heart, a YouTube channel. You know what is the description of YouTube for me? The description of YouTube for me is why only your patient know, while the whole world can know. This is a YouTube channel. And by the way, I take advantage of being here in this really respectable conference, and I invite you to like and subscribe.
انت بتجربي فينا الاعلان والحاجات دي، عايزين نقدر.
This is what I do. I do now marketing. Did you see? You can make marketing anywhere, everywhere, anytime. This is only example. You know, if you start a new technique, you want to start with a big failure. Now, how you make that clinic really successfully through issues. Patient selection is number 1 and perfect one. You know, for example, don't select a patient who delivered 5 times normal vaginal delivery and promised her that you're really gonna do vaginal tightening by HIFO or laser or radio frequency. She's not a patient for you. She's only patient for surgeon, or you can go for surgery, okay? Tools, material, selection. You have to choose your material, you choose your new devices. I'm not meaning choose material, meaning expensive material. No, I mean reliable. Your colleague really tried the device and told you, tried the material and recommended for you. Don't give false hopes. As example for peeling, don't promise the patient that she will be milky white. No, promise her that we decrease your color to a 2 degree than your usual. That is realistic. Be realistic, please. Talk is really, 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 really adorable to me. You have to talk about everything. How many sessions? How much it costs? How much time between the sessions? What is the side effect? What is the complication? Even the procedure, painful or not? And really photographing is a must, really. You know why? After 2 or 3 sessions, the patient can't tell you, I'm not satisfied. You tell me I become whiter. Okay, bring me the photo. If the patient refuses that you photograph by her mobile, okay, and tell her to keep the picture and let her know the first session, before the session, her color or her skin shape was what, and after 3 sessions become what. Okay, now she will be satisfied. Offer. Oh, offer. As I said before, just right now, I told you, I make offers. They come. Where the word offer exists, the patient from everywhere will come. The more the offer really was successful or real, the more the patient will come. Because they are not really patient. She just wants to regain her beauty, her body, her activity. Aesthetic gynecology will make your patient stuck to you forever, because you have a magical solution for her or her complaint. Like Dr. Asim said in his conversation. 1 minute, okay, I finished. 1 minute. You know what? As Dr. Asim said, mommy makeover. For example, my dearest doctor, your patient will come to tell you, my dearest doctor, After you deliver me, my abdomen didn't come back. Okay, don't worry, my dearest patient, I have a perfect solution. You can now choose. I have liposuction, I have cavitation, and I have HIFU. Are you satisfied? Okay, but what about after reduction my abdomen? I have redundant skin. Don't worry also, I have solution for that. I have laser, I have HIFU, I have radio frequency for firming your skin and tightening your skin. Are you satisfied now? Still no. I have darker skin in my sensitive area. Don't worry, we have simple procedure. We can do a peeling for you and whitening cream. We will do after that. Perfect, my doctor. Is that enough? No, doctor, please. After I really deliver, I have a stretch mark, and even my scar keloid is very ugly, and I'm not really satisfied with my shape. Okay, I'm with you, don't worry. You can now make a laser, we can make a plasmage, we can inject a PRP. Now you have a lot of solution for the patient. Are you satisfied now? No. What else? I have after I finish my lactation, I have redundant breasts. Okay, we can do laser, radio frequency, HIFU. Okay now? No, not enough. Not enough. I have stress incontinence after I deliver normal vaginal delivery. I have stress incontinence. Don't worry, we have PRP, we have HIFU, we have laser. Did you see? The patient will stuck to you forever. It's complementary and must. Okay? What you gonna lose? Only you will lose some money, but you will gain new experience, new service, you gain trust of your patient, you gain stuck your patient with you forever. You can trust yourself first. Okay? Thank you.
Thank you very much, Dr. Najwa. This is a real experience, and we are appreciating what you are saying. We have really 3 interesting presentation, filler by Dr. عمرو, and then احنا عندنا الدكتورة رانيا هتكلمنا كلام جميل قوي عن الMRI والاكسبيرينس بتاعتها في الجاينيكولوجي وازاي احنا